Welcome to the Fasting Podcast, Wow, Wellness and Optimal Weight. I'm your host, Julie Phillips, certified natural health professional, bringing you episode 120, Glutathione, Key to Health and Longevity. We're going to start by talking briefly about free radicals, which are atoms that are missing an electron in our body, and that can cause it to steal an electron from a healthy atom, making that one a free radical. So there's a ripple effect as we're robbing these electrons. The free radicals that contain oxygen, and there are a lot of these in the brain, are called ROS, reactive oxygen species. Well, we all have some free radicals. We have toxicity, stress, processed food, smoke, pollution, extreme exercises. So many things can cause free radicals, and therefore we get oxidized, like leaving a piece of fruit on your counter and it turns brown. We get premature aging inside and outside the body with the free radicals. Well, antioxidants are the good guys that have extra electrons to donate, like a vitamin C. And when it does that, it can neutralize the free radical and stop the cascade of robbing. Glutathione is the mother of all antioxidants, and after it donates the electron, it actually recycles itself and can donate over and over again. Not only that, glutathione also can reinstate antioxidants like vitamin C that have already donated, so they can now continue to donate. Glutathione is used by over 400 different processes in the body, and 15 of them are crucial to life. So without any glutathione, you could actually be dead within 2 minutes. Dr. Oz has done a whole show on glutathione in the past and said it's the most powerful antioxidant that you never heard of. It's one of the keys to fighting off the diseases you fear the most. So glutathione, sometimes referred to as GSH, is created in the body, and it's a tripeptide. It's contained cysteine, glycine, and glutamic acid. So it's a tripeptide with those 3 amino acids. The liver does produce it, and it exists within every single cell in our body. Glutathione is the primary protector of our cells and the primary detoxifier of our cells. It's also the primary protector of mitochondria DNA. And mitochondria is our cellular batteries, crucial. It's the protector of the immune cells and instrumental in immune function and balancing, I might add. Hemoglobin, or the blood, cannot attach to oxygen without glutathione. Impossible. And the brain uses about 20% of the body's oxygen, so very important to have enough glutathione to get the oxygen around the body where it needs to be. Here's a biggie. The body cannot make white blood cells for immune defense without adequate glutathione. When we drink alcohol, it becomes highly toxic acetaldehyde, and the liver actually shuts down other processes to try to neutralize it with glutathione. So people that do drink alcohol and end up with the liver issues, the glutathione is typically very low levels. Now, comparing vitamin C has about 75,000 clinical studies. For glutathione, there's over 160,000 studies on PubMed on glutathione, and it talks about topics like inflammation, leaky gut, fatty liver, autoimmune, insulin resistance, even cancer, and so many more. Let's just highlight a few of the potential benefits. Immune booster, joint support, cognitive health, sustained energy, improved sleep, improved immune system big time, improved workout performance and recovery, improved liver health, which may affect weight, and improved skin. Well, there are potential for improvements in all the body systems and all the health challenges virtually. We have a major deficiency in much of our population of glutathione, And after the age of 20, we typically lower our level of glutathione 8 to 15% per decade. So you can see where the seniors stand as far as typical, and it could be worse depending on your exposure to the possible causes. What are some of the possible deficiency signs? Lack of energy, joint muscle aches and pains, fatty liver, autoimmune, gut issues, frequent infections, anemia, seizures, intellectual disability, loss of coordination, fatigue, memory, neurological, breathing, hearing, vision, all of those types of issues, poor sleep, brain fog, serious disease, and the list goes on. This is a major deal that I found a paper online, and we have the link in our PDF at the website, we'll say at the end. By the 2020, it was the American Chemical Society publication, and the title is Endogenous Deficiency of Glutathione as the Most Likely Cause of Serious Manifestations and Death in COVID-19 Patients. What are some of the possible causes of the deficiency? Well, stress is a biggie, toxins, poor diet, pollution, aging as we discussed, medications including antibiotics but not limited, trauma, infections, artificial sweeteners, especially high fructose corn syrup. There's something called acetaminophen in things like Tylenol, smoking, insufficient sulfur that we like to get from things like leafy greens and cruciferous vegetables like broccoli, cauliflower. Heavy metals is a factor, and extreme too much exercise, believe it or not, can actually be possible causes of glutathione deficiency. Now let's talk about some possible options for getting more glutathione. Well, the obvious one is resolve all the possible causes of deficiency that apply to you that we already talked about. And again, you can get copies of these slides. And when you're improving your diet, if you need to, make sure you pay attention to things like organic leafy greens, cruciferous veggies, foods high in organic folate and selenium, foods high in vitamins C, E, B6, B9, B12, and biotin, and get the methylated forms of the B vitamins, not the synthetic versions. Herbs like turmeric and milk thistle. Do your research online when you're ready to look at your diet. Here's a really nice one for the regular audience for this podcast. Clean fasting with education like this podcast actually may help the body with its glutathione level, providing ketones to the liver for some nice clean creation of energy in our cells. Here's a nice one. Love your liver. Clean it. Check your visceral fat because we don't want to have fatty liver. And episode 92 talks about is visceral fat your problem? There's an inexpensive body composition scale, several of them you can get for less than $30 on Amazon. But love your liver. It does the detoxification and so many more things in our bodies. Supplemental glutathione. Now, both glutathione and cysteine, you remember there were 3 amino acids in the tripeptide, and that's the one that's the most fragile of the 3 and difficult to get. So both glutathione and cysteine are so fragile they can be destroyed if you take like a capsule, and the hydrochloric acid in the gut will have potential damage, so absorption can be low or practically nil. That's why for so many years experts have been promoting precursors like N-acetylcysteine, hoping the body would create more. Intravenous is done by certain doctors, but that can be expensive and definitely comes with risks. So if you're considering IVs from doctors, check that out of what the potential risks are. I'm excited that there's a recent breakthrough in nanosizing the glutathione with ultra-purified water, and it puts glutathione and extra L-cysteine, the one that's fragile, right into the bloodstream from mucous membranes in the mouth, so you do a swishing action. That's amazing. And the same technology also offers a skin spray that has the nanosized glutathione, nanosized hyaluronic acid, collagen, and 5 other peptides for the skin. And this offers the best before and afters by far I've ever seen on anything to do with the skin. I just ordered both of these two. Who wants to test it with me? Contact me, Julie, at jpwowprograms.com. Check out our website, jpwowprograms.com, and that's where you can also see previous episodes and the slides that were used for each of those. Please refer others to our podcast and YouTube, and for questions and feedback and how to test the new glutathione technology with me or find out how I did with it later, email me, Julie, at jpwowprograms.com. Stay positive, focused, and determined, because where the mind goes, energy flows.